This video presentation is not meant to replace or substitute for the printed CAM Rescue Cath instructions for use or other product labeling materials included with the product. Please read the product instructions for use completely prior to use. For questions regarding the proper use of this product, please contact your local distributor or the manufacturer, Omneotech, 800-493-0911. Please read the additional legal disclaimer at the completion of this video. Failure to adhere to the instructions for use may result in serious injury to the patient. Do not use this catheter if the packaging or any catheter component appears damaged. Return the damaged catheter in its package to the manufacturer. Remove any other catheter or device present within the endotracheal tube prior to use of the CAM Rescue Cath. To prevent unnecessary or improper contact between the CAM Rescue Cath and the patient's natural airway, ensure that the endotracheal tube is appropriately positioned within the trachea, and the CAM Rescue Cath is properly calibrated to the patient's endotracheal tube. Over-insertion of the endotracheal tube or the CAM Rescue Cath beyond the calibrated depth may result in injury to the patient's airway. During use of the CAM Rescue Cath, always stabilize the endotracheal tube with one hand to prevent its dislodgement, and be prepared to secure the patient's airway by other means such as reintubation or tracheostomy. Use only under the direction of a physician. This device is single-use only. Do not re-sterilize it. Use the appropriate size CAM Rescue Cath based on the endotracheal tube size. This catheter is not intended for use in patients ventilated through a tracheostomy tube. Each pass with the CAM Rescue Cath through the endotracheal tube should last no longer than approximately 10 seconds. When cleaning the endotracheal tube with the CAM Rescue Cath, do not simultaneously apply suction through the catheter. Always use universal precautions as indicated by clinical conditions. Hold the CAM Rescue Cath next to the patient's endotracheal tube, taking care to not contact the patient or any item with the sterile catheter tip. Align the numbered markers on the CAM Rescue Cath with the corresponding numbers on the endotracheal tube. Depress and advance the depth calibrator tab until the depth calibrator disc abuts the top of the endotracheal tube. Make note of this calibrated position, which marks the proper insertion depth for the CAM Rescue Cath. If the ventilator tubing was disconnected from the endotracheal tube for the calibration procedure, then reconnect it to the endotracheal tube. Take care to not move the depth calibrator tab or depth calibrator disc from this calibrated position during suctioning or cleaning of the endotracheal tube. Ensure that the CAM Rescue Cath has been properly calibrated to the patient's endotracheal tube. Maintain the suction port open. Disconnect the ventilator circuit tubing from the endotracheal tube. Advance the CAM Rescue Cath into the endotracheal tube until the numbered markers on the CAM Rescue Cath align numerically with the markers on the endotracheal tube and the depth calibrator disc abuts the top of the endotracheal tube. Avoid advancing the CAM Rescue Cath with excessive force, as the depth calibrator could be pushed away from its calibrated position and result in over-insertion of the CAM Rescue Cath through the endotracheal tube. Stabilize the endotracheal tube with one hand. With the other hand, grasp the CAM Rescue Cath handle and depress the syringe plunger until some resistance is felt. May require inflation with less than 3 cc of air. Ensure that the CAM Rescue Cath depth of insertion within the endotracheal tube does not shift during balloon inflation. Withdraw the CAM Rescue Cath completely from the endotracheal tube. Depending on the size of the endotracheal tube and the consistency of the secretions, it may be necessary to adjust the volume of air instilled in the balloon as the CAM Rescue Cath is withdrawn from the endotracheal tube. Reconnect the ventilator circuit tubing to the endotracheal tube. If multiple passes are necessary, secretions may be rinsed from the catheter using sterile saline. Secretions should not be manually wiped from the catheter tip. Discard the used CAM Rescue Cath. Do not re-sterilize or store it for repeated use. For questions regarding the proper use of this product, please contact your local distributor or the manufacturer at 800-493-0911. 0911.